So air cleaners, yeah. Air cleaners are actually really effective for those particles in the air, which are the form of pollution that we think is actually the most damaging. What you want to look for is actually what's called a HEPA, H-E-P-A, filter. And the important thing is actually to make sure it's sized correctly for the room. So you can't have a small air cleaner or filter that will clean your whole house. But actually what we recommend is actually people put one of these in the room that they spend the most time in, which often is the bedroom or maybe a family room. And we've actually done a study in Smithers up in northern BC and shown we put these air filters in people's homes. They actually didn't know whether they were operating or not, so we actually took the filters out, but the lights were still on and things. And then we measured actually a number of these blood vessel function changes were improved when the air cleaners were on. These inflammatory markers in the blood that Dr. Van Eeden talked about, we actually got lower levels just actually after operating these for a week in people's homes. They're not expensive. I don't work for an air cleaner company. There's many of them, but they're between $100 and $200. They're really not that expensive. The energy costs are minimal, maybe $30 to $50 a year for the energy to run them. The biggest complaint people have is they can be somewhat noisy, but it's something, if you happen to live in a place where you can't avoid the air pollution, it's something I really do recommend.
Is there a filter that you would recommend? That's one of the questions that people have.
Yeah, so anything that's what's called a HEPA filter, and generally I would say the simpler the better. You can get very fancy things, and actually some of the very fancy air cleaners actually produce ozone, which is a pollutant that we actually want to avoid. So the simpler the better, no bells and whistles, just a HEPA filter. And you can also get these if you have a furnace in your home, not that many people actually here do, you can actually get filters, these same kind of filters that could be a part of your air handling system if you happen to have a furnace.
So what about pollution from barbecues?
It's a good question. It's not something that has been studied a lot. There was actually a proposal in Los Angeles a number of years ago to sort of ban barbecues. So on average, it does contribute to air quality. For any one individual, I wouldn't be too concerned just because we don't spend hours and hours in front of a barbecue. Certainly gas barbecues are much cleaner than charcoal, but it's just something that I think certainly governments are very reluctant to regulate. But I would say in general, it's probably not a major concern.
So does marijuana smoking have significant effects on the heart and lungs as cigarette smoking?
So this is also an area that hasn't been studied as well as cigarette smoking, but some of the studies that they've done have actually shown that marijuana smoking is actually more damaging than cigarette smoking. Because they've put filters on cigarettes for a very good reason, because at least it takes some of the particles and the toxic things that cigarettes has in them out. Normally cigarettes have something like 4,000 different toxins in them. It hasn't been that well studied in marijuana, but certainly there's fairly good substantial or circumstantial evidence that marijuana smoking is just as bad as smoking or even worse.
What is the typical size of the particulate matter in cigarette smoke?
The typical size is usually very small. The size is, it's more in the range of fine or ultrafine particles that you get in cigarette smoke.
Can air pollution affect one's eyes?
So certainly there's irritation to the eyes, just like you would get irritation in your upper respiratory tract. There is eye irritation. The best sort of information we actually have is that scenario in developing countries where people are cooking over open fires for a long time, for their whole lives. And in those situations, you actually see cataract development associated with that exposure. I'm not aware of any evidence in kind of the developed world for anything beyond irritation, but we can definitely measure irritation, which seems to be quite transient. But in terms of chronic effects, I'm not aware of any evidence. But presumably, if you were exposed, in a similar scenario like that developing country situation, it could be severely damaging to your eyes.
And I could maybe just add to it, we know that the eye is just as vulnerable for atherosclerosis as other blood vessels. There's also very important vessels in the eyes. So although it hasn't been studied very systematically, I assume that the same process that you can get in other arteries, you can also get in the eyes, that's the arteries that supply the eyes.
What air pollutants in one's home can be damaging?
So in homes, actually indoors, we can measure lots of things. By far the most important would be smoking, which would be secondhand smoke. Besides that, there have been a number of studies looking at things like cooking emissions, looking at actually gas stoves. So when you're actually burning gas, you produce nitrogen dioxide, which is a pollutant. There's also lots of consumer products. In general, all of those things have the potential to lead to health impacts. They tend to be quite subtle, more on the sort of irritation. There have been some studies looking at showing things like subtle influences on memory, even for example. But the important thing are those sort of effects tend to be very transient. If you can remove those sources, there doesn't seem to be any long-lasting effect. Again, the one exception would be smoking. So tobacco smoke is the most important.
I can maybe just add to it is that Southeast Asia study that they've done, they've actually looked at the finer particles outside and inside the buildings, and there wasn't much of a difference. So by just going in the building, you may protect you maybe from more bigger, larger particles, but the fine particles get into the building. There was also a study that was published a couple of years ago from Australia where they've actually measured these very fine particles in an office building, in a big communion office building. And they find out that these finer particles, carbon particles, was much higher in the building than outside, and they related it to the printers. Because we know that printers work with graphite. So if you have a big office building with a lot of printers, and all those printers works a lot, you get a lot of these very fine particulate matters. And as I pointed out, this is actually the ones that reach very deep into your lung.
And just one other thing I'll add about sort of indoor air pollution would be mold. So we actually have a lot of evidence of dampness, water damage surfaces in homes, and presence of mold being linked to a number of health outcomes. Again, if you remove it, you seem to improve. It doesn't seem to lead to long-lasting health effects.
So that question was a great segue to this question. So what do you think about working at the gym right on major streets like the beautiful new YMCA?
It's actually interesting that I come from South Africa, and South Africa, road running is very popular. We have one race every year that's nearly 100 kilometers, that 20,000 people. And there was a guy in Cape Town, and he've already in the 70s done studies. And in those days, there was still a lot of lead and gas, and he actually just measured lead levels. And people that practice for running and do this big race, and have shown that if you practice and you run next to a big road, your lead levels is much higher in your blood and your urine than people that runs in a park or somewhere away from a road. Similar to the studies that Michael have sort of pointed out, the relationship between traffic and your exposure.
Yeah, so just to add to that, I think, in general, in the studies that we've done and other people have done, exercise is still beneficial, even exercise in pollution. But we shouldn't have to make the choice, and I think that's really the issue. So we're doing a number of studies of cyclists now, and
It's okay. It's okay.
okay. And generally, what we find is that cycling, getting exercise is good for you, and those benefits outweigh any risk associated with air pollution. But if we can find ways, and so for example, we can find ways that we can get exercise in less polluted areas, then those benefits are even greater. And I think there's a number of ways to do that. The example of a gym, well, I would actually ask, what kind of filtration do they have, that kind of thing. It's a good question to ask.
Mm-hmm. How toxic are candles indoors?
So we don't know a lot about sort of toxicity, but actually candles are huge producers of these small particles. You can get levels that would be much higher than you'd measure in a very polluted city. And you think about it, I mean, you're burning this stuff, where is it going? Well, it's going into the air. There's no studies I know of showing health impacts, but sort of by analogy, it's certainly plausible, and we definitely know the levels can be very, very high.
I'm going to have to redecorate my whole house now. So the comment is that, what about beeswax candles?
I don't know.
We're all taking a chance. So the question is, what about the role of calcium intake in terms of how it relates to maybe protecting you from air pollution? Is there any role, or in terms of atherosclerosis? Is there any minerals or supplementation, particularly calcium, that could be helpful?
So I'll just start. I mean, I don't know anything about calcium, but certainly antioxidants. And there have been some studies to suggest that antioxidants or omega-3 fatty acids that you would get in fish, some small studies show that they protect against some of the harmful effects of air pollution. These studies have the best studies have actually been done in Mexico City. That population is a population that tends to be somewhat nutritionally deprived. So it's not clear that, let's say, a higher nutritionally adapted population would have those same benefits, but they do seem to show some blunting of the air pollution response.
Yeah, so we know that the disease that everybody think about is sort of osteoporosis, and osteoporosis is actually a very interesting disease. But one of the things that have come out the last 10 years is that a very big contributor to osteoporosis is systemic inflammation, just that bloodstream inflammation that I talked about. And we know that people with a lot of atherosclerosis got more bloodstream inflammation than people with less atherosclerosis. So, just by analogy, you can think if you're exposed to a lot of air pollutants and you've got a lot of bloodstream inflammation, you may also more tend to develop osteoporosis. And obviously, calcium and vitamin D is two, and exercise is the three cornerstones of combating osteoporosis.
So often when air quality is bad, it's recommended that people remain indoors, but sometimes, as you had alluded to, the indoor air quality may also be problematic. Is there any way to protect oneself when outdoors, if they have to go outdoors and they have respiratory issues?
So, I mean, the sort of obvious answer is masks, and if any of you who've spent time in Asia, you'll actually see large numbers of people wearing masks. It's not something, so they do work. The problem is they have to be fitted perfectly to the skin, which is usually quite rare that people actually fit them well, and then you have to wear them all the time. So I've seen really bizarre things, when I've been in Asia, where people will have a mask in their pocket, they'll pull it out, across the street, and then they'll put it back in their pocket, and you're just fooling yourself. And in fact, there's even, if you wear a mask, you certainly increase the resistance to breathing as well, so that could actually have negative effects. Avoidance is really what you want to do. You can think about places, and you can think about time of day. So if you have to be outside, we have a very strong daily pattern of pollution, which you can all figure out is rush hour. That's when you don't want to be outside, you don't want to be in traffic. If you can avoid certainly heavily trafficked areas during those periods or avoid those areas altogether, that's the most effective way.
So chlorine in the swimming pool area, in the air, how hazardous is it?
This is actually much more a problem of patients with asthma or hyperreactive airways. For whatever reason, is that a lot of these people may react from the chlorine in the water. That is, it's the same as to say, how bad is if you go near the sea and there's a lot of waves. There's also some mist that produce, and some of that mist contains minerals and so on, which is a sort of a natural particle, just like dust, if there's dust storms and stuff. So those things all have an effect. As I mentioned, it is actually the particles that those macrophages in the lungs see that they need to deal with that many times sort of start the whole process. Composition is a very important component of particles, and one of the concepts that have developed is that fossil fuel burning, the way we burn fossil fuels nowadays, is actually new for the human race. It's not something that we've been exposed for thousands and thousands of years. So it's something that our system needs to handle, that it hasn't had all that thousands of years to adapt to. While things like dust and things like that, we've been exposed to it for centuries and centuries. We most probably handle that a little bit better than if we expose people to something more artificial.
Yeah, and just to add on the swimming pool issue, there have been a number of studies that suggest that chlorine in the swimming pool reacting with organic material, so it's primarily sweat and urine, reacts with that to actually produce a gas that people can inhale. And that's been linked in a number of studies to respiratory disease in children, but there's also just as many studies that haven't shown that effect. But in response, you'll know that certainly many pools have actually lowered the chlorine levels or gone to other disinfection systems. That's one reason. The other thing is you'll see actually in many pools, signs to shower before you swim. That's why. So so the chlorine itself may not be that bad, but the chlorine reacting with the other stuff actually can be bad. And if you shower and are relatively clean when you swim, there's less stuff in the air. So I would just urge people to actually take those signs seriously if they swim.
So that's a public health message I wasn't aware of in terms of the mechanism. I just thought you wanted to be clean before you went in the pool, but there's an added reason.
And basically, if the people swimming are cleaner, then they need less chlorine in the pool as well. So it's just everybody benefits.
So the question is, why are some people more affected or sensitive to pollutants such as perfume, cigarette smokes, or even just household cleaning products? Some people tend to react more to them. Is there any, particularly from a respiratory point of view?
So just in general, we're doing some studies now on genetics and the interaction with genetics and air pollution. And there are a few genes that about half the population has differences in those gene activities, and these genes are linked to actually general detoxification. So that's one reason that there just are genetic differences that actually seem to be quite common that make people more or less susceptible in general to pollution. That's one reason. Now you can say more.
I think there's not, it's true that we're starting to do genetic studies now on air pollution. For cigarette smoke, there's actually been studies done for a long time. We know that people that smoke cigarettes, just about 20% of them will develop emphysema and chronic bronchitis. So there's still 80% of people that smoke that never develop it. So there must be a other reason why that is if they exposed to the same dose. And we think it is to a large extent our certain differences in our ability to handle certain toxins in our environment. And you know, the toxin that we all know it's really important for us to handle is actually oxidants. So if we can we can neutralize those oxidants very